Hello, my name is Rachel Bentley, and I'm currently an ICU nurse at UK Healthcare and an MSN graduate student at EKU. I'll be presenting my topic, the impact of family presence in the adult intensive care unit, developing policies and procedures for family witness cardiac resuscitation. The clinical question focuses on family presence during cardiac resuscitation in the critical care setting. The question is, during cardiac arrest performed on adult ICU patients, how does the presence of family members during resuscitation compared to their absence improve patient and family outcomes of care? There will be a point in time where each person is presented with difficult decisions regarding a loved one's care, yet when confronted with these care decisions, most are not prepared. It is common to see families struggle with decision-making regarding complex treatment, and then healthcare providers be unprepared or inadequately trained to deliver timely, clear, and concise education, or even fully discuss all plan of care options regarding end-of-life care measures. This is why family presence in the intensive care unit during cardiac resuscitation remains a controversial issue for patients' families and the clinical team. In industrialized countries, cardiac arrest accounts for 600,000 deaths annually, placing witness family members at a high risk for emotional and physical burden. Patients' families are deeply affected by this issue due to an unfamiliarity of the ICU setting and what cardiac resuscitation involves. However, being present during cardiac resuscitation may help family members understand all life-saving measures were implemented in the attempt to bring their loved one back to life. Family presence during cardiac resuscitation is a national priority. The American Association for Critical Care Nurses highlights the issue as a practice alert. AACN's expected practice, supported by evidence-based research, advises an approved written practice document, such as a policy, procedure, or standard of care, be presented to a patient's family, allowing the options of presence at the bedside. This problem is significant because despite support by professional organizations such as the AACN and critical care experts, a mere 5% of U.S. critical care units have a written practice document permitting and encouraging family presence. The review of literature presented level 2 to 3 evidence with the use of randomized controlled or case control methods to examine the impact of family presence during cardiac resuscitation in the ICU, emergency department, or at home with EMS response. The intervention of family presence during cardiac resuscitation was highly supported in all studies to improve communication between families and the clinical team and effectively cope with the final outcome of a loved one. Study 1 aimed to discover whether relatives of patients wanted to be present during cardiac resuscitation, and if so, the adverse psychological effects of witness resuscitation on bereaved relatives. According to Robinson, results of the study showed a downward trend toward lower degrees of post-traumatic avoidance behavior, anxiety, and symptoms of grief in the relatives who had witnessed the procedure. Study 2 aimed to discover the effects on relatives of family presence in an Australian emergency room during cardiac resuscitation. Its greatest contribution included improved communication and coping, and relatives were overall grateful just for the opportunity to be present. Study 3 aimed to discover whether offering a relative the choice of observing cardiac resuscitation might reduce the likelihood of post-traumatic stress disorder-related symptoms. Family presence during cardiac resuscitation was associated with positive results on psychological variables and did not interfere with medical efforts, increase stress in the healthcare team, or result in medico-legal conflicts. Overall, resuscitation effectiveness was not affected by the presence of a family member, nor was the duration of cardiac resuscitation, the selection of drugs, or the survival rate. Study 4 aimed to discover differences between cardiac resuscitation survivors and patients admitted as an emergency case. This study showed 67% of resuscitated patients prefer loved ones to be present during cardiac resuscitation. This was a unique perspective and the first study of its kind to interview resuscitated patients. Family involvement is continuously promoted on my unit in adult medicine ICU. However, documentation is not available and education regarding family presence during cardiac resuscitation rarely occurs. When it does take place, it's often too late and the clinical team is already in the midst of a code, which creates a very chaotic time for family to absorb the situation at hand. A clinical practice document educating and encouraging family presence during cardiac resuscitation upon ICU admission would be beneficial in preparing families for the possibility of clinical deterioration and the difficult decision-making that follows. This action will help to drive patient-centeredness, improving communication between patients, families, and the clinical team. Thank you for your time.